When we think about innovation, our minds usually jump to shiny labs or high-tech hospitals. But innovation is just as critical, maybe even more so, in the places we actually call home and in the communities that support us every day. Today, we're going to dig into a really interesting plan from Scotland that's trying to fix a major imbalance in how we innovate care. So let's get right into it. It really all starts with this one fundamental question. We put so much energy and focus into advancing healthcare, right? So why does it always feel like social care? The system that actually helps people live well in their own homes and communities is constantly playing catch up when it comes to new tech and fresh ideas. And this slide, wow, it just lays the whole problem out perfectly. It really is a tale of two different worlds. On one side, you've got healthcare innovation. It's usually well-funded, coordinated, and gets put on the fast track. But then you look at social care innovation, and it's a completely different story. Underfunded, scattered, and just generally undersupported. Now, this isn't just a hunch or a feeling that people have. It's a reality, and it's backed up by some pretty solid evidence. So let's take a look at what the research is actually telling us about this off-balance system. So, a 2023 report from the Fraser-Ollander Institute found that, yep, social care is seriously underrepresented in Scotland's big national innovation programs. And this isn't just a Scottish thing either. A review over in Wales found the exact same pattern, much weaker support for social care compared to health. And the root causes? They're always the same. Efforts are all over the place, there's no single place to see what actually works, and there's just a real lack of strategic leadership pulling it all together. And here's the real kicker. The official channels for getting new ideas off the ground, like Scotland's Anaya Pathway, were basically built for the National Health Service, the NHS. Their whole structure, their priorities, how they're governed, the money they have, it just wasn't designed to meet the very different needs of social care, social work, or housing. And if you want to see what that imbalance looks like in cold, hard numbers, well, it looks like this: 0.02%. Okay, so here's what that tiny number actually means. Between 2023 and 2025, projects for innovation in social care got about £42.6 million. In that exact same period, the healthcare budget was over £214 billion. That means the investment in social care innovation is a tiny, tiny fraction, just 0.02% of the healthcare budget. It's staggering. But, just pointing out a problem is the easy part. The really exciting part is the solution that's been built to tackle this exact gap. So, let's check out this new approach. So everyone, meet the Digital Care Collaborative Scotland, or DCCS for short. It launched in December 2025, and it's a community designed specifically to drive that much-needed digital innovation right where it's been missing the most. And its mission is crystal clear. It's all about creating the right environment, the right conditions for digital innovation to actually take hold and grow across social care, social work, and housing. The whole point is to speed up the adoption of digital tools that can genuinely make people's lives better. And this is so important. This is not some top-down, stuffy government body. It's a genuine collaborative. It's a community that brings absolutely everyone to the table: national organizations, tech companies, university researchers, and crucially, people with direct lived experience of the care system itself. And you can see just how broad this partnership is right away. You've got organizations like COSLA, which represents all of Scotland's local authorities, working right alongside major care providers represented by Scottish Care. And it doesn't stop there. The Alliance also includes vital advocacy groups like the Alliance, which champions the voices of people who use services, and the Scottish Federation of Housing Associations, because we all know that a good home is the foundation of good care. Okay, so we know who they are. But what is this powerful new collaborative actually going to do? Well, their work is all built around a really clear 5-point plan. Now, these 5 priorities weren't just picked out of thin air. They were built from the ground up through tons of co-design sessions with everyone involved, from care providers and government officials to academic experts. This ensures the whole strategy is really grounded in what's needed in the real world. Okay, let's just run through them real quick. Number 1, creating the right conditions for innovation to thrive. 2, building a strong network so people can share knowledge. 3, gathering solid evidence of what actually works. 4, developing practical tools people can actually use day to day. And finally, number 5, building up the digital skills and confidence of the workforce. It really covers all the bases. And this whole thing came together pretty deliberately. It all kicked off in 2024 with a big review of the landscape. By early 2025, the recommendation for a national, joined-up approach got the green light. And by the end of that same year, the DCSS was officially launched and ready to get to work. All right, so we've defined the problem, we've got the solution in place, but what does it all really mean on the ground? Why does this new way of doing things actually matter for the future of care in Scotland? Well, the DCSCS creates value in 4 really key ways. First, it brings parity, giving social care the dedicated strategic focus it's been missing for so long. Second, it builds sustainability by creating a clear pathway for resources. Third, it aims for a massive cultural shift, making digital innovation feel normal, not like some weird add-on. And finally, it drives real transformation based on solid evidence of what actually helps people. And, this quote from the report just sums up the entire vision so perfectly. It's all about taking all this amazing work that's already happening in different pockets and just bringing it all together. By aligning all those scattered efforts, you create something so much bigger than the sum of its parts. You create the conditions for change on a truly meaningful scale. Which kind of leaves us with this one big final thought to chew on. We've seen how this model is designed to fix a very specific problem in social care. But what if it's actually a blueprint for something much, much bigger? Could this kind of collaborative, sector-led approach be the real key to unlocking innovation? Not just in care, but across all of our public services?